Curious, somebody with normal free T3, because that's, I guess, one of the best tests to see how much thyroid hormones you have in the body. No. And but if somebody has elevated thyroid antibodies, it doesn't matter what your free T3 is.
Correct. Doesn't matter what any of it is.
Can you explain that a little bit? And why, with adequate amount of free T3, we're still not getting good function?
It isn't not getting good function. It's having symptoms and having problems. It's not a deficit of thyroid hormone. So the autoimmunity is not taking away the thyroid hormone. It's causing these problems via a range of other mechanisms. And most thyroid disease is not a lack of thyroid hormone. That's only overt hypothyroidism, which is very rare.
But the treatment tends to be more thyroid hormone.
That's a common treatment. That's really gone. Yeah, there's a big disconnect between the medical literature and medical practice. So overt hypothyroidism is where the T4 is tanked way below range and the TSH is like greater than 20. In that case, thyroid medications can improve health. They're not the only option, but they can be helpful. Short of that, what we call it is subclinical hypothyroidism or suboptimal hypothyroidism. And one large study in the British Medical Journal a couple of years ago showed that of over 1 million patient years, that people with subclinical hypothyroidism, so elevated TSH, marked abnormalities, that thyroid medication did not, as a class, improve quality of life symptoms, did not lower disease risks, did not benefit things such as weight or fatigue, and did not actually worsen mortality risk overall. So
really?
So most of it is not a lack of thyroid hormone.
Well, that's very discouraging, since a lot of anti-aging doctors, so I'm in the anti-aging field, and optimizing the numbers, if that's what a lot
early in my practice, I was in the A4M, I was in their second ever meeting, I guess, in 95. And I kind of came away with this idea that we could read blood levels and we could make the body, we could restore hormonal optimization. And that was all, and that you'd be the same as a healthy person. So one big paper from Korea looked at people on thyroid medication and looked at large cohorts that were pretty much identical in terms of thyroid levels and identical, just very well matched in terms of overall risk symptoms. And what they showed was that the total mortality risk was more than doubled in those on medication. So we've got all these data sets. So making hormones is not the same as taking hormones. And the blood levels don't always show the difference. So a lot of it goes on behind the scenes. But people who endogenously can make thyroid hormone are not the same as those who exogenously take thyroid hormone, even natural hormone, even the right amounts. It's not the same as what the body does at the end of the day.
So if a patient comes to me, let's say the free T3, it's 2.3. And so in anti-aging medicine, A4M, by the way, is American Academy of Anti-Aging Medicine. So they recommend a level of above 3.5 for free T3. And then they recommend the TSH to be below 1.2, right? So somewhere there. So if a person's TSH, let's say, is 1.5 or 1.8, and their T3 is 2.3, an anti-aging doctor would tend to supplement a little bit, add a little bit of armor thyroid, which is a combination of T3 and T4.
So the difficulty is
do more harm.
There's two different questions that it took me a lot of time to see the difference here, but there's two different questions. So one question is, could these levels, if they're not optimal, could they correlate with some health problems, right? And the second question, which seems like it's the same as the first question, it seems like if the answer is yes, that these levels could be a problem, that therefore treating these levels is a solution. But that's a different question. It's not the same question. You can't say if someone has a higher TSH, they don't feel well. That doesn't infer necessarily that pushing the TSH down by exogenous medication will reverse that problem. That's what we thought for so long. And the scenarios that I described to you from the British Medical Journal study, those are all way more advanced disease than you're talking about. That's like so much further along. And those people don't improve their health outcomes. And this is why people are always trying to adjust the dose and track this and track that. It's a fool's errand to begin with in most cases. Briefly, this is a topic I get passionate about. There's all these data sets. So the whole thing about needing high T3. So there's a valid argument that healthy people generally have a lower TSH. A lot of good data points support that. Now, a lot of folks who didn't have a thorough understanding of thyroid physiology assumed that therefore healthy people should have a high T3. The truth is, yes, there is an inverse relationship to TSH and T3. However, only at the extremes. Only at the extremes of hyper or hypo will you see a reverse relationship. T3 is not how much hormone landed in the body. T3 is highly regulated. Think about serum calcium. You don't drink a glass of milk and have your serum calcium go through the roof for an hour. Your body buffers the heck out of that. And T3 is the exact same way. It's where you want it to be based on what you've got to work with. So the idea that healthy people should always be high, there have been a lot of studies. People can look this up easily. There's a lot of studies saying, what are populations like that have high levels of T3? They get more breast cancer, they get more diabetes. It's more common in the obese populations. It's not reflective of healthy people. And just the idea that the TSH and T3 are stuck on this string and they do this, they don't do that. And doctors see that when they try to push the T3 up just a little bit and the TSH plummets. That happens all the time. It's because these things are not regulated by the same mechanisms.
Do you think there's a detriment for TSH to plummet? I remember I've tried taking thyroid supplementation, right? My TSH was less than 0.01. So
you're honestly asking me if there's a risk to smoking. That's what this question is like. Seriously, the medical data behind that, there's no controversy about this. There's a lot of doctors who, because they try to have high T3, they want to ignore low TSH, but you've got to bury your head deep in the sand. There's a person I spoke to 2 days ago, and she reached out and said, "You saved my life." I was seeing a doctor who tried to push my T3 up and she was ignoring my TSH. I was in the emergency room twice and I almost died of congestive heart failure. And I stumbled across what you've talked about this. This is a big mistake that's being done in anti-aging medicine and it's harming people. The TSH is not just telling your thyroid to work. It's telling your blood vessels to repair themselves. It's telling your brain to repair new cells. It's telling your bones to fix themselves. We need some TSH for a lot of reasons. Long before there's high levels of T3 or T4, a low TSH is a risk factor. We've got big data sets of those who naturally have a low TSH. This is called subclinical hyperthyroidism. And we have big data sets from people who were treated for thyroid cancer that intentionally had suppressed TSH levels. They're not good. We know this.
So, the gold standard, in a lot of fields is to only check TSH. But then in anti-aging medicine, I think the T3 and T4 had come to the forefront and they really want to optimize that. So you think that's misguided?
I think that nothing should be ignored. I don't think it's only about this thing or that thing or the other thing, but we also can't ignore any of the blood markers. We can't say that someone can have completely abnormal blood markers and we're not going to worry about that. So T3, T4 are important. The idea of having them have to be high normal, I can't find good evidence to support that. But the idea that you can ignore one of the blood markers and say, yeah, we're going to pretend that one's fine, even though it's not. No, you can't do that.
Okay. So you would just leave it alone if somebody has a little bit higher TSH and then kind of low normal of the T3, T4.
So if someone has early thyroid disease or suboptimal levels, again, there's two separate questions. There's can that make them not feel well? And does that benefit from medications? And a third question is, are there other options? So you don't have to let someone not feel well. You've got other options. You can simply start by modulating their iodine intake.
So if they're feeling well, then you won't really touch the thyroid hormones unless they're grossly abnormal.
Yeah, there's an argument about at what point does overt disease or subclinical disease become an independent risk factor in the context of someone who's asymptomatic. And that's highly based upon age, health status, pregnancy, other things along those lines. But yeah, someone who's asymptomatic, that's not the populations I really see or work with. I see the opposite, those who are symptomatic in various ways. But yeah.
Right. Yeah. But I'm in the anti-aging field and, I treat a lot of, serious diseases too, but optimization has been such a mantra that you need the hormone to be at certain levels, but it doesn't sound, intuitively.
Well, again, you got to pull apart, does an abnormal hormone cause a symptom? You got to pull that apart from, does exogenous use of that hormone correct that problem? They're separate questions. And you can only answer, and you can't assume that the second question is answered by the first question. You can only say that someone is improving their health by taking this thing if you can look at large data sets of people who've been closely tracked who have taken that thing. And we've done that now in the thyroid world. We've seen that barring more overt disease, it just doesn't help. People just don't do better as a group and they don't have better health outcomes.
Okay. All right. So if somebody has subclinical, maybe thyroid not quite optimal, maybe they have, their energy level could be improved, and the numbers, not too impressive with TSH and T3, T4, would you then embark on this thyroid reset diet?
That's the simplest thing. There's good data about nutraceuticals being helpful as well. But yeah, those steps plus the thyroid reset diet are strong evidence behind them being useful.
Okay. And I remember meeting you, and then you weren't that enthusiastic about supplementing thyroid hormone itself.
Well, I shouldn't say that. It's got a place, and there's a lot of folks where it's been positively life-changing, and many people need it. I've been a prescriber of it for a long, long time, but I think it's overused. I think that in more cases than not, like the study that I mentioned, the BMJ study, it argued that conventional patients, 85% of them never needed thyroid medication that were put on it. And those are conventional patients. I would argue that in our worlds of natural medicine, it's a higher number than that. And it's not beneficial. And there are risks to it as well. There's a lot of cancer risks that are associated with use of thyroid medication. There's greater mortality risks. It's a significant intervention that one needs to think through.